At this juncture, we will discuss about antipsychotic agents. Antipsychotic agents are also known as neuroleptics or psychotropics, but the preferred name for this group is either antipsychotics or neuroleptics. The term neuroleptic refers to any drug that modifies psychotic behavior and exerts an antipsychotic effect. Now let's move forward to discuss antipsychotic agents and its indication. Psychosis is defined as the loss of contact with reality. Manifestations or signs and symptoms of psychosis include the following: difficulty processing information, disorganized thought, distortion of reality, delusion, hallucination, incoherence, catatonia, aggressive or violent behavior. Schizophrenia, a chronic psychotic disorder, is the major category of psychosis in which many of the mentioned symptoms are manifested. Antipsychotic medications or antipsychotic agents are divided into two categories. We have the typical antipsychotic agents and the atypical antipsychotic agents. So, what's the difference between these two? The typical antipsychotic agents are effective in treating positive symptoms of schizophrenia. Again, only positive symptoms of schizophrenia. While for the atypical antipsychotic agents, these are effective in treating both the negative and the positive symptoms of schizophrenia. Okay, let me repeat on that one. Typical is only effective for positive symptoms of schizophrenia, while for atypical, it is effective in treating both the negative and positive symptoms of schizophrenia. Typical antipsychotic agents have specific subclassifications, which include phenothiazine and non-phenothiazine. Under the phenothiazine group, examples of which are the aliphatic phenothiazines, the piperazine, and the piperidine. Non-phenothiazine, we have the butyrophenones, the benzoxazepines, the hydroindolones, and the thioxanthines. Examples of medications for the atypical antipsychotic agents include clozapine, olanzapine, risperidone, quetiapine, ziprasidone, and aripiprazole. Antipsychotic agents block the action of dopamine and thus may be classified as dopaminergic antagonists. Specifically, it blocks the dopamine receptors. There are five subtypes of dopamine receptors numbered as D1 through D5. All antipsychotic agents block the D2 or the dopaminergic receptor, which in turn promotes the presence of extrapyramidal symptoms. Extrapyramidal symptoms include pseudoparkinsonism, akathisia, dystonia, and tardive dyskinesia. We will discuss more about these extrapyramidal symptoms at the later part of this discussion. On the other hand, atypical antipsychotics have a weak affinity to D2 receptors and a stronger affinity to D4 receptors, and they block the serotonin receptor. These agents cause fewer extrapyramidal symptoms than typical antipsychotic agents, which have strong affinity to D2 receptors. Now we will discuss the typical antipsychotic medications first. First, we will discuss the phenothiazine group. Under the phenothiazine, we have the aliphatic. Aliphatic medications produce a strong sedative effect, decrease blood pressure, and may cause moderate extrapyramidal symptoms. An example of an aliphatic medication is chlorpromazine hydrochloride thorazine. Next, we have the piperazine. Piperazine produces more extrapyramidal symptoms, dry mouth, urinary retention, and agranulocytosis. An example of this medication is the fluphenazine and perfenazine. Next is piperidine. Piperidine has a strong sedative effect, few extrapyramidal symptoms, has a low to moderate effect on blood pressure, and has no antiemetic effect. An example of this classification of medication is thioridazine. Most antipsychotics can be given orally in a form of tablet or liquid. It can also be given intramuscularly or intravenously. For oral use, the liquid form might be preferred because some patients may hide tablets in their cheek or under their tongue to avoid taking them. Mouth checks are necessary for non-compliant patients. Phenothiazine metabolites may cause a harmless pink to red-brown urine color. The full therapeutic effect of oral antipsychotics may not be evident for 3 to 6 weeks following initiation of their therapy, but an observable therapeutic response may be apparent after 7 to 10 days. Let's now discuss non-phenothiazines. First up, under non-phenothiazine, we have the butyrophenone group. A frequently prescribed non-phenothiazine, specifically under butyrophenone, is haloperidol. Haloperidol's pharmacologic behavior is similar to that of the phenothiazines. It is a potent antipsychotic drug in which the equivalent prescribed dose is smaller than that of drugs of lower potency. The drug dose for haloperidol is 0.5 to 5 milligrams. Administration precautions should be taken to prevent soreness and inflammation at the injection site. That is if the medication is administered intramuscularly. Because the medication is a viscous liquid, a large gauge needle such as gauge 21 should be used with a Z-track method for administration in a deep muscle. The injection site should not be massaged, and sites should be rotated. These medications should not remain in a plastic syringe longer than 15 minutes. Take note, this is true if the medication is administered intramuscularly. There are also capsules or tablet forms of haloperidol. Next is dibenzoxazepine. This classification of medication has moderate sedative and orthostatic hypotensive effect. An example of this medication is loxapine. Another classification of medication under non-phenothiazine is a dihydroindolone. This medication has low sedative and orthostatic hypotensive effect. An example of this classification of medication is molindone. Lastly, the thioxanthine. This classification of medication produces low sedative and orthostatic hypotensive effect. An example of this classification of medication is a thiothexine. Side effects and adverse reactions of antipsychotic medications include drowsiness, dry mouth, increased heart rate, urinary retention, constipation, decreased blood pressure, blood dyscrasias, photosensitivity, and extrapyramidal symptoms. Under extrapyramidal symptoms, it includes pseudoparkinsonism, akathisia, dystonia, and tardive dyskinesia. Pseudoparkinsonism is characterized by stoop posture, shuffling gait, rigidity, bradykinesia, tremors at rest, and peel rolling motion on the hand. Characteristics of akathisia include restlessness, trouble standing still, paces the floor, and feet in constant motion, rocking back and forth. Acute dystonia is characterized by facial grimacing, involuntary upward eye movement, muscle spasms on the tongue, face, neck, and back. The back muscle spasms cause trunk to arch forward. Further, in acute dystonia, there is laryngeal spasms. Tardive dyskinesia is characterized by protrusion and rolling of the tongue, sucking and smacking movements of the lips, chewing motion, facial dyskinesia, and involuntary movements of the body and extremities. These extrapyramidal symptoms can begin within 5 to 30 days after initiation of antipsychotic therapy and are most prevalent with the phenothiazines, butyrophenones, and thioxanthines. Tardive dyskinesia may develop in 20% of patients taking antipsychotics for long-term therapy. Neuroleptic malignant syndrome is a rare but potentially fatal condition associated with antipsychotic drugs. Predisposing factors include excess agitation, exhaustion, and dehydration. Neuroleptic symptoms involve muscle rigidity, hyperthermia, altered mental status, profuse diaphoresis, blood pressure fluctuations, tachycardia, dysrhythmias, seizure, rhabdomyolysis, acute renal failure, respiratory failure, and coma. Treatment of neuroleptic malignant syndrome involves immediate withdrawal of antipsychotics, adequate hydration, hypothermic blankets, and administration of antipyretics, as well as benzodiazepines and muscle relaxants such as dantrolene. Now let's move on to atypical antipsychotic agents. These are effective in treating both positive and negative symptoms of schizophrenia. These are not likely to cause extrapyramidal syndrome. Drug examples of atypical antipsychotic agents include clozapine, olanzapine, risperidone, quetiapine, ziprasidone, and aripiprazole. Common side effects of atypical antipsychotic agents include weight gain, drowsiness, unsteady gait, headache, insomnia, depression, diabetes mellitus, and dyslipidemia. Knowing the side effects and adverse reactions of a medication will guide you on what specific nursing diagnosis you're going to formulate. Further, it will also guide you on what specific nursing interventions you're going to apply. For example, if the side effect of the medication is drowsiness and unsteady gait, what nursing intervention should you apply to your patient? It may include assisting the patient in ambulation, checking your patient from time to time, especially that your patient will be at risk for fall, and in the case of diabetes mellitus, what nursing intervention should you apply? It is to check the blood sugar level of your patient. So you see, if you know the adverse effects and the side effects of the medication, it will guide you again on what specific nursing interventions you're going to apply. Take note of these drug-to-drug interactions. Phenothiazines can decrease the effect of anticonvulsants. Thus, an adjustment on the dosage of the anticonvulsant may be necessary, but take note that it has to be prescribed by the physician. So you as a nurse, your responsibility here if and when the patient has seizure and is taking an anti-seizure medication is that you need to inform the physician right away so that the physician can adjust the dosage of the medication. Another is the following potentiates the effect of antipsychotic medication: the alcohol, hypnotics, sedatives, narcotics, benzodiazepines, and atropine. Also, antihypertensive medications can cause additive hypotensive effects. So what is the nursing implication for this one? You need to monitor the vital signs of the patient, particularly the blood pressure. What should comprise your assessment for a patient who's taking a phenothiazine or a non-phenothiazine medication, or in general an antipsychotic? You must assess baseline vital signs for use in future comparisons. Obtain a patient health history that includes present drug therapy. If the patient is taking an anticonvulsant, the drug dose might need to be increased because antipsychotics tend to lower the seizure threshold. Further, you need to assess mental status and cardiac, eye, and respiratory disorders before starting drug therapy, and continue daily assessment. Possible nursing diagnoses you can formulate are ineffective relationship related to social withdrawal, risk for loneliness. What is our plan? Why are we administering phenothiazine or non-phenothiazine medication to our patients? It is to improve the psychotic behavior of our patients through medications, psychotherapy, and adjunct therapy. The administration of antipsychotic medications to our clients will require the nurse to monitor vital signs because orthostatic hypotension is likely to occur. Remain with patients while medication is taken and swallowed because some patients hide antipsychotic medications in the mouth to avoid taking them. Avoid skin contact with liquid concentrates to prevent contact dermatitis. Liquid medications must be protected from light and should be diluted with fruit juice. Administer oral doses with food or milk to decrease gastric irritation. Dilute oral solution of fluphenazine in fruit juice, water, or milk. Avoid apple juice and caffeinated drinks. Administer deep into muscle because drug irritates fatty tissue. Do not administer intravenously. You also need to check blood pressure for marked decrease or increase 30 minutes after drug is injected. Do not mix in same syringe with heparin, pentobarbital, cimetidine, or dimenhydrinate. You also need to observe for extrapyramidal symptoms such as acute dystonia, akathisia, pseudoparkinsonism, and tardive dyskinesia. You also need to assess for presence of neuroleptic malignant syndrome. Record urine output because urinary retention may result. And you need to monitor serum glucose level. Further, you need to inform patients that medication may take 6 weeks or longer to achieve full clinical effect. Caution patients not to consume alcohol or other CNS depressants such as narcotics because these drugs intensify the depressant effect on the body. Teach smoking cessation because smoking increases the metabolism of some antipsychotics. Guide patients to maintain good oral hygiene by frequently brushing and flossing teeth. Inform patients about extrapyramidal symptoms and instruct them to promptly report symptoms to a healthcare provider. Encourage patients to wear sunglasses for photosensitivity, to limit exposure to direct sunlight, and to use sunscreen and protective clothing to prevent a skin rash. Suggest lozenges or hard candy if mouth dryness occurs. Advise patient to consult a healthcare provider if dry mouth persists for more than 2 weeks. And advise patients to rise slowly from sitting or lying to standing to prevent a sudden decrease in blood pressure. Do not forget to evaluate the effectiveness of the drug and whether the patient has acceptably reduced psychotic symptoms at the lowest dose possible. Ascertain whether the patient can cope with everyday living situations and attend to activities of daily living. Determine whether any side effects of adverse reactions to the drug have occurred. At this time, we will now focus on anxiolytics. Anxiolytics are primarily used to treat anxiety and insomnia. Signs and symptoms of severe anxiety attack include dyspnea, choking, chest pain, heart palpitation, dizziness, faintness, sweating, trembling, shaking, and fear of losing control. Before giving anxiolytics, non-pharmacologic measures should be used for decreasing anxiety. These measures might include using a relaxation technique, psychotherapy, or support groups. The medication used to treat anxiety is benzodiazepine. Benzodiazepine has multiple uses, such as anticonvulsant, sedative hypnotic, preoperative drug, substance abuse withdrawal, and anxiolytic. Most of the benzodiazepines are used mainly for severe or prolonged anxiety. Examples of benzodiazepines include chlordiazepoxide, diazepam, clorazepate dipotassium, lorazepam, and alprazolam. The most frequently prescribed benzodiazepine is lorazepam. Many of the benzodiazepines are used for more than one purpose. For a patient who is taking benzodiazepine and is experiencing anxiety, should be assessed for suicidal ideation, obtain a history of the patient's anxiety reaction, determine the patient's support system, such as family, friends, and groups, and also obtain a drug history, report possible drug to drug interaction. A possible nursing diagnosis you can formulate for a patient with anxiety is anxiety related to situational crisis. The combination of both pharmacologic and non-pharmacologic interventions aim to reduce the anxiety and stress of the patient through pharmacologic methods like the use of benzodiazepines or support in group therapy. Nursing interventions for patients taking benzodiazepine will include observe patient for side effects of anxiolytics, recognize that drug tolerance and physical and psychological dependency can occur with most anxiolytics. Monitor vital signs, especially blood pressure and pulse, because orthostatic hypotension may occur. Encourage family to be supportive of the patient. Advise patients not to drive a motor vehicle or operate dangerous equipment when taking anxiolytics because sedation is a common side effect. Warn patients not to consume alcohol or CNS depressants such as narcotics while taking anxiolytics. Inform patients that an effective response may take 1 to 2 weeks. Encourage patients to rise slowly from sitting to standing positions to avoid dizziness from orthostatic hypotension. After the administration of the medication, as well as the application of the non-pharmacologic measures, you need to evaluate the effectiveness of drug therapy by determining whether the patient is less anxious and more able to cope with stresses and anxieties. Also, determine whether the patient is taking the anxiolytic drug as prescribed. This time, we will discuss antidepressant agents. Antidepressant agents are types of medications that are used to treat clinical depression or prevent it from recurring. Depression is the most common mental illness affecting approximately 14.8 million Americans. This is characterized primarily by mood changes and loss of interest in normal activities. The types of depression are reactive, major depression, and bipolar disorder. Antidepressants are divided into five groups. The first is the tricyclic antidepressants, or TCA, or also called as tricyclics. Second is the selective serotonin reuptake inhibitors, or SSRIs. Third is the serotonin norepinephrine reuptake inhibitors, or SNRIs. Fourth is the atypical antidepressants. And fifth is the monoamine oxidase inhibitors, or called as MAOIs. Tricyclic antidepressants, or TCAs, are used to treat major depression. This blocks the uptake of neurotransmitter norepinephrine and serotonin in the brain. Clinical response is after 2 to 4 weeks of drug therapy, meaning that's the time that the patient will feel the therapeutic effect of the medication. Side effects and adverse reactions of the medication include orthostatic hypotension, sedation, anticholinergic effects, cardiotoxicity, and seizure. We've been mentioning anticholinergic effects. What is the most common anticholinergic effect that we've mentioned ever since we started this topic? That is urinary retention. Please take note of that. Drug examples of TCAs or tricyclic antidepressants include amitriptyline, imipramine, trimipramine, doxepin, and clomipramine. Take note that alcohol, hypnotics, sedatives, and barbiturates potentiate the CNS depression when taken with TCA. That is why it is essential that you educate your patient to avoid these substances or these classifications of medications when the patient is still taking TCA. Next is the selective serotonin reuptake inhibitors or SSRIs. This group of antidepressants block the reuptake of serotonin in the nerve terminals of the CNS. This is used for major depressive disorders. Drug examples of SSRIs include fluoxetine, fluvoxamine, sertraline, paroxetine, citalopram, and escitalopram. Take note that many SSRIs have an interaction with grapefruit juice that can lead to possible toxicity. So what is the nursing implication for this one? You need to educate your patient to avoid grapefruit juice when taking selective serotonin reuptake inhibitors. Side effect of the medication includes dry mouth, blurred vision, insomnia, headache, nervousness, anorexia, nausea, diarrhea, and suicidal ideation. The next group is serotonin norepinephrine reuptake inhibitors or SNRIs. It is called serotonin norepinephrine reuptake inhibitors because this group of medication inhibits the reuptake of serotonin and norepinephrine. This is used for major depression, and drug examples include venlafaxine, duloxetine, and desvenlafaxine. Side effects of SNRIs include drowsiness, dizziness, insomnia, headache, euphoria, amnesia, blurred vision, and ejaculatory dysfunction. What will be the nursing implication if one of the side effects of this medication is insomnia? The nursing implication is it is best to administer this medication in the morning. Adverse effect of this medication includes hypertension, tachycardia, angioedema, seizures, and suicidal ideation. The fourth group of antidepressant is the atypical antidepressant. This is the second generation antidepressant. This is used for major depression, reactive depression, and anxiety. It affects one or two of the three neurotransmitters, which are serotonin, norepinephrine, and dopamine. Drug examples of atypical antidepressants include amoxapine, nefazodone, moprotilene, and trazodone. This group of antidepressants should not be taken with MAOIs and should not be used within 14 days after discontinuing MAOIs. The fifth group of antidepressant is the monoamine oxidase inhibitors or the MAOIs. This group inhibits MAO-A and MAO-B. MAO-A inactivates dopamine in the brain, and MAO-B inactivates norepinephrine and serotonin. This is used for mild, reactive, and atypical depression. Drug examples for MAOIs include tranylcypromine sulfate, isocarboxazide, siligylene hydrochloride, and phenelzine sulfate. Take note that when MAOI is concurrently administered with a CNS stimulant or sympathomimetic like ephedrine, it may result to hypertensive crisis. How do we define hypertensive crisis, by the way? It is a severe increase in blood pressure that can lead to stroke. Okay? Another is if MAOI is taken and the patient eats tyramine-rich foods, it could also result to hypertensive crisis. What are examples of tyramine-rich foods? It includes aged cheese, cream, yogurt, coffee, chocolate, bananas, raisins, Italian green beans, liver, pickled foods, sausage, soy sauce, yeast, beer, and red wines. So what is the nursing implication for this one? You need to monitor the blood pressure of the patient. Side effects of the medication include agitation, restlessness, insomnia, orthostatic hypotension, and anticholinergic effects. At this juncture, we will now walk through to mood stabilizers. Mood stabilizers are used to treat bipolar affective disorder. This is a psychological illness that involves severe mood swings. These mood swings take the form of depression or mania and may last for several months at a time. During the time of depression, patients often have a great sadness, guilt, no appetite, poor sleep, and cannot enjoy themselves. Mania is the opposite of this, with patients experiencing erratic and excited behavior. Drug examples of mood stabilizers include lithium, carbamazepine, valproic acid, valproics, and lamotrigine. These are considered as the first line of drugs for bipolar disorder. Now, let us focus on lithium. Lithium is an inexpensive drug that must be closely monitored because it has a narrow therapeutic serum range of zero point 0.8 to 1.2 milliequivalent per liter. Serum lithium levels greater than 1.5 milliequivalent per liter may produce early signs of toxicity. The serum lithium level should be monitored biweekly until the therapeutic level has been obtained, and then it must be monitored at least every 1 to 2 months on the maintenance dose. Serum sodium levels also need to be monitored because lithium tends to deplete sodium. Side effects of lithium include dry mouth, thirst, increased urination, weight gain, bloated feeling, metallic taste, and edema on the hands and ankle.